Good morning. According to the U.S. Center for Disease and Control, nearly 1 in 68 children in the United States is affected or diagnosed of autism, in which boys are 4 or 5 times more likely to be diagnosed with autism than girls. As April was Autism Awareness Month, I thought I'd share with you guys some information on what autism is, how children are diagnosed of being autistic, and part of the treatment process. During my son's 18-month checkup, he was flagged for being at risk of being autistic. Although we're still waiting on the official diagnosis, whether he's autistic or not, for the better part of a year now, I've done some research on my own on what autism is. So we'll start there. What is autism? Webster's Dictionary defines autism as a developmental disorder that appears by the age of 3 and that is variable in expression but is recognized and diagnosed by impairment of the ability to form normal social relationships, by impairment of the ability to communicate with others, and by stereotyped behavior patterns, especially as exhibited by a preoccupation with repetitive activities, of restrictive focus rather than with flexible and imaginative ones. In May of 2012, autism was thrown under the umbrella of autism spectrum disorder, which encompasses a wide variety of developmental issues and developmental disorders like autism. On the spectrum, on the far left side of the spectrum, you would have your high-functioning autistic individuals. These individuals with the right behavior conditioning can lead a full, healthy life that you wouldn't know that they were autistic. On the other hand, on the right side of the spectrum, you would have your nonverbal autistic individuals. These individuals would be unable to live independently of a care provider. Now, knowing what autism is, going and diagnosing autistic can prove to be a little bit difficult. There are symptoms out there that doctors and parents should be aware of to look at their child. Some of these symptoms could include no babbling by the age of 12, or I'm sorry, by 12 months old, unable to speak a word by 16 months old, or put 2 words together for a sentence. Another big one is by 6 months old, if they just your child has no expression or emotion on their face. Those are some big symptoms of an autistic child. But going about diagnosing autism is difficult, since there is this wide spectrum of autism. There is no one test that can determine whether an individual is autistic or not. So your child has to go see a specially trained physician or psychologist who has the ability to administer autism-specific behavioral evaluations. Now, during this evaluation, they will just observe your child play normally. They will place demands on your child to see how they go about meeting those demands, and they'll make their recommendation from there. Now, after a child has been identified as being autistic or at risk of being autistic, a behavioral interventionist will come in, and they will have their own evaluation, much like what the physician did. And during this evaluation, they'll still place some demands on your child, and they will notice the areas of deficiency in your child's development. Once they have these areas identified, they will make a plan for your child with goals for them to meet. Now, during these sessions or therapy sessions, not only is it including the child, but the parents are also expected to participate. And like the child, the parents themselves have goals on how to master the conditioning and reinforcers that are being shown to the child. This way, well after the therapy session has ended, the parents are able to continue on with the conditioning so that their children can better learn the behaviors that are being taught to them. So Again, like I said, as April is Autism Awareness Month, I hope that after this you guys might have a little better understanding of what autism is. Um, Although diagnosing autism can be difficult, once treatment is started early, many autistic individuals are able to lead happy, healthy lives. Thanks for listening.